Tembisa, 40 kilometers northeast of the Joburg CBD, has been around since the 1950s.
I was born here, I grew up here, I did my high school, my primary school here.
Xolani Mnisi is from the Tembisa Community Forum, a youth-led movement to improve service delivery. Apart from wanting to clean up the streets of Tembisa, making sure people get the health services they need is a priority.
Other Tembisans do share the same sentiments that we are not entirely happy. That's the reason why last year we marched to the Tembisa Hospital to send a memorandum of grievances from Tembisans.
Tembisa Hospital is an 840-bed facility that serves about 2 million people. It's a tertiary or specialist hospital, which means patients are referred here from Ekurhuleni, Joburg, Tshwane, and from surrounding informal settlements.
We know that Tembisa Hospital is quite undercapacitated. It is not only rendering services to Tembisans, but also other surrounding areas, including areas like Deep Sloot. You will find doctors that are dealing with high number of patients, really much affecting how service is given to patients.
People dread having to go there.
This is not on. Guys, I'm here in Tembisa Hospital right now as we speak. Look how our human beings been stored. I may call it stored.
Residents will go there, and when they come back, they'll be having appalling comments about how they were treated, from casualty, even in wards.
This video, published by News 24, has earned the hospital a poor reputation.
It is precisely this video that prompted us to stand up as the forum and as a community to go and protest at the hospital. And I was very much aggrieved, because I've been in that hospital casualty on a weekend. It would be very much scary.
Last year, a new ward with 36 more beds was built, and Gauteng province has plans for a 300-bed mother and child facility.
So we do acknowledge that the staff that side are trying their best, and they're undercapacitated, and government is aware of that. We expect government to do something about it.
In September 2023, the Special Investigating Unit began delving into maladministration at Tembisa Hospital. This after News 24 investigative journalist Jeff Wicks reported on how crime syndicates extracted up to R1 billion from Tembisa Hospital with the help of hospital staff.
People receive parlous treatment in public hospitals because of resource constraints. That this is the same hospital where a man starved to death because the nurses forgot to feed him. So it speaks to systemic issues.
His investigation into the murder of Babita Deokaran, a Gauteng Health Department accountant turned whistleblower, uncovered the graft she died trying to expose.
She found that companies that had no public presence and had very strange names were getting tens of millions of rands worth of business in very quick succession. And she also found that the pricing of the contracts was very strange. We saw thousands of transactions being processed by Tembisa Hospital in a matter of months, and for incredible items like children's skinny jeans, for bonded leather wingback chairs, for arts and craft supplies. Millions upon millions of rands were just being channeled out of that hospital.
This unchecked spending can only hurt healthcare for ordinary citizens.
And it also gives us a window into perhaps this is happening elsewhere. What about other government hospitals and clinics? Because also what we found was that these same companies that were doing a roaring trade at Tembisa were also getting contracts from at least 5 other health facilities in this province. So this is not an issue surrounding a single hospital. This is an issue that really underpins public health procurement in South Africa.
The SIU has confirmed that Tembisa Hospital contracted suppliers who intended to cash in on deals without providing services, and that there were irregularities in the bid documents. Although 6 men pled guilty to Deokaran's murder, there's been no action against those who ordered her killing. Alex van den Heever from the Wits School of Governance says corruption in the health system can happen when individuals exploit gaps and take a chance. But it's corruption that comes from the top that's the most difficult to deal with.
Top-down corruption is when it's organized from leadership level. And that is really the one that has a systemic impact on the performance of the health sector or any facility, because it's from the leadership level, allows them to essentially establish networks of corruption, which make it much more difficult for accountability structures to operate. And therefore they're making decisions about procurement and what gets delivered in their own private interests, not in the public interest, because it effectively collapses the effective delivery of healthcare services across the board, quite aside from the money that gets lost.
We have this thing called the Health Sector Anti-Corruption Forum that's headed up by the Special Investigating Unit. So they're tasked with fast-tracking fraud and corruption cases in this sector. And that also includes the NHI fund. In your view, how will this actually protect the fund against abuse in the future?
It's not a protection at all. One thing that one's got to be wary of is the establishment of what I call fake accountability structures or weak accountability structures that are easily evaded, a bit like the ANC's integrity committee. It creates the impression that there's some kind of accountability structure in place. But when you see the ultimate effect, it's really there to whitewash. Well, the key vulnerability is we allow political appointments into the administration that allow basically criminal syndicates to be set up in our public structures.
We've tried to get people from this forum and these law enforcement bodies to talk to us about the progress they've made. And all we've really found out from them from a written statement is that several cases have been handed over to the Hawks. Are you of the opinion that this isn't enough to deter fraud and corruption?
It's inexplicable that with the levels of evidence that we have against this very serious top-down corruption in South Africa, that they're unable to prosecute anybody. So this is my concern. The NPA quite clearly isn't doing its job, and the Hawks are not doing their job. And all of those structures are failing. So the SIU might do certain things and look like it's an accountability structure, but what happened to digital vibes? What happened to these cases? The people that get implicated in them are still running around, despite the fact the SIU provided the evidence. So quite clearly, somebody's perfectly happy for that information to go out. But when it gets to the actual rubber hitting the road in terms of investigation and prosecution, it all just goes into a black hole.
Is it even possible for something like the NHI to work? And if so, how?
From the very outset, they don't make sense from the perspective of an improved health system. My concern with the NHI proposals, and which render it basically unworkable, is that it is designed for patronage. It's not designed for public health.
Back in Tembisa, Olani says they just want decent health services.
The honest truth is that normal people don't care about tenders and stuff. The only thing that they care about is the services that they receive. But unfortunately, such issues of corruptions, they do have a bad effect in terms of service delivery, which we cannot run away for. And we're hoping that the law enforcement will take its course. However, we will also continue doing what we do on our side as civil movements to say, while the law is taking its course, the government, the provincial government, and the officials must ensure that people are not affected.